That variety care is more than just a clinic or a health facility in Oklahoma City or in Oklahoma. I think that the opportunity that variety care brings to any community is helping to recreate the community. That what we're doing now is starting at a very basic, fundamental need, and that is to be healthy.
I think until people see the inside of our facility, that they have no understanding of the capacities that exist within each one of our clinics. If people within this community understood that, I think they would be very proud to have variety down the street. I think they might take their mothers there. I think they might take their kids there. Again, I think we are a model of what healthcare can be. And it exists where it exists right now because you have dedicated people wanting to take care of people who are doing without.
I feel like I'm a part of something bigger that is making an impact in our community and in individuals' lives as well as families, and I just love being a part of it.
We really have an incredible team of people that are just passionate about kids, and that really makes a big difference.
You know, variety care is very unique in the fact that they have an amazing team environment. It's not an individual taking care of a patient, it is a team taking care of a patient. We work very well with the other healthcare professionals, behavioral health, the providers and prescribers, the medical assistants. Everybody together is very collaborative in their efforts to make sure that the patient is put first.
One of our pediatricians talked about having an adolescent in his practice whose body mass index, BMI, was quite high. So his body weight was quite a bit higher than you would want for a child at that age. So we have a nutritionist that we referred this child and his family to and started working closely with this nutritionist. And literally he showed me the BMI chart and held it up. And from the date that he made that refer to our nutritionist and this child started working with the nutritionist, the BMI went on a nosedive in the right direction in line with where you would want it to be. But that was because he had access to care. That was because he could come in as a sliding scale patient probably, or as a sooner care patient and get good quality medical care with the physician and then be able to have a relationship with that provider over time.
Our staff is very driven by our patient satisfaction, by the outcome of their health. It definitely makes them happy getting a thank you from a child, even though they don't do it right after their immunizations, but they definitely do say it after they've come back and seen that they feel better from coming to see us. And that's really the things that make these staff members happy. These are the things that keep them coming back every day to work and coming back with a smile.
Yesterday when I saw a patient, you know, she sat there and said, she goes, "This is the most anybody's ever listened to me." You know, the fun part about being a physician is that you're able to, if you listen to the patient, you're able to allow them to tell you what's going on, what their disease is. So yesterday we got to talking and we just happened to kind of discuss further on her history, and all of a sudden the diagnosis just blossomed out and we were able to figure out that one thing could explain all the different things she's been having for the past 6 months and seen all those different specialists. And so she looked at me, almost started crying and said, "No one's ever taken the time to listen." You know, so there's, you know, every day that I get to interact with a patient is, you know, it adds something like that.
I was at work and I got a phone call from a close personal friend who has suffered lifelong multiple health issues. One of those health problems, along with primary care issues, was dental, actually. And he had been to a family friend of his who was a dentist and got a quote for all the dental work that he needed. And it was just an outrageous amount. I immediately referred him to Variety Care, and my friend became a patient of Variety Care. The dental work that he got, which was extensive over a period of time, cost him approximately a quarter of what the private dentist had charged him. With the dental work and a new smile, he was able to land that job and has been working ever since and feels so much better about himself. And that's a kind of cool human story, and it's the everyday story with Variety Care patients.
In Variety Care's future, I think that one of the things that's most exciting is that we're actually going to have an impact. I don't believe in the idea that bigger is better unless bigger is making something better. And for us, being able to get more people into healthcare as early as they possibly can and to make it affordable for them to do that, I think one of the things that's the most exciting is that we'll really make a difference. And if people have access to primary care, it's proven with all the data and all the studies that people who have access to primary care are more healthy. And so if we can provide more primary care to more people, then we ought to be able to change some of the very, very depressing statistics in health in Oklahoma.